In this video, we will talk about the key symptoms of lymphoma, how non-Hodgkin lymphomas are classified, and how they are treated. What are some key symptoms of lymphoma? Signs and symptoms of non-Hodgkin lymphoma may include enlarged lymph nodes in the abdomen, groin, neck, or underarms, an enlarged spleen or liver, fatigue, shortness of breath, fever that cannot be explained by an infection or other illness, random and unexplained weight loss, sweating including night sweats, itchy skin and chills. More specific symptoms include unexplained weight loss of more than 10% of the patient's original body weight during the 6 months before diagnosis, unexplained fevers with temperatures above 100.4 degrees Fahrenheit or 38 degrees Celsius, drenching night sweats. Patients often state their clothes or sheets on the bed are actually soaked. How are non-Hodgkin lymphoma cancers classified? You may hear a doctor refer to someone's lymphoma as stage 1, 2, 3, or 4. Staging describes where the cancer is located, how much or whether it has spread, the impact of the cancer on other organs of the body. Stage 1 is the most localized, and stage 4 is the most spread and aggressive. Non-Hodgkin lymphoma is often classified by growth rate. The first category is indolent or slow-growing. For example, these include follicular lymphomas, cutaneous T-cell lymphoma, and lymphoplasmacytic lymphoma. The second group are more aggressive and fast-growing cancers. For example, these include diffuse large B-cell lymphoma, anaplastic large cell lymphoma, and Burkitt lymphoma. What is follicular lymphoma? Follicular lymphoma is the most common type of indolent lymphoma, accounting for about 20% of all lymphoma cases in the United States. This cancer is usually found in the bone marrow or lymph nodes and is most common in middle-aged or older adults. In many cases, follicular lymphoma grows so slowly that the only treatment required is monitoring its growth. Other treatment is needed if it progresses or spreads to other areas of the body. What is diffuse large B-cell lymphoma? DLBCL. DLBCL is the most common type of lymphoma. About 30% of non-Hodgkin lymphoma cases in the U.S. are DLBCL type. Approximately 40% of the time, this type spreads to other organs outside of the lymph system. DLBCL can be cured in about half of the patients who develop it. The most common chemotherapy regimen is a regimen of 4 drugs: cyclophosphamide, doxorubicin, vincristine, and prednisone, plus an antibody therapy known as rituximab. What is Burkitt's lymphoma? Burkitt lymphoma is also known as Burkitt cell leukemia because it is a blood cancer. Burkitt's lymphocytes are often called the fastest growing human tumor because it can spread and be fatal very quickly. However, treatment of early stage 1 and 2 is usually successful, with survival rates higher than 90%. In Africa, 98% of cases of Burkitt's are associated with Epstein-Barr virus. But this form of cancer is rare in the United States, with only 1,200 people being diagnosed each year, the majority of whom are over the age of 40. How is non-Hodgkin lymphoma treated? Chemotherapy is the main treatment for non-Hodgkin lymphoma, with the addition of radiation therapy when necessary. Chemotherapy is generally successful in treating and often curing non-Hodgkin lymphoma. Other treatments include immunotherapy, targeted therapy, radioimmunotherapy, chimeric antigen receptor or CAR T-cell therapy, and in rare cases, bone marrow or stem cell transplantation. That's all for today. Please reach out to your doctor if you have further questions about non-Hodgkin lymphoma.